It's a three-part study aimed at identifying the incidence of cancer in the prison population, and then to explore whether being diagnosed with cancer in prison affects people's clinical outcomes. So do they get the same treatment as the people in the general population, and is their survival similar to that to the general population? And then the second part of the study was around looking at what it's like for someone to be diagnosed with cancer in prison, and then also the experience of the professionals, so both the prison and oncology staff in the community. So what we found was that the incidence rates for cancer are similar to the general population, but for men there are certain cancers that are less likely to be diagnosed in prison, so colorectal, prostate and testes cancer. Men are less likely to be treated surgically, and that the survival rates for men in prison is poorer than in the general population. In terms of experience, there are a number of points in the diagnostic pathway where there were key barriers to being diagnosed. So getting an appointment with a GP in prison is quite a hard process, because people have to submit a written application which is triaged by healthcare, and they may or may not get an appointment on the basis of that triaging process. And then there was evidence, there were people talked about how having prison officers who escort the patients in some of in the consultations could inhibit discussions around sensitive issues. And then obviously there were common themes that emerge around communication between patients and their oncology professionals, which is largely limited to the face-to-face consultations that they have when they attend hospital, and communication difficulties between all the professional groups that largely are due to structural issues within the two organisations. So really, we found that there are material differences in the care that people who are diagnosed with cancer in prison get.